Good evening and welcome to Real Talk. Tonight we'll be discussing treating moderate to severe plaque psoriasis and active psoriatic arthritis with Cosentyx. Before we begin, I'd like to introduce you to our panelist speakers. We're joined by Jordan and Darren. Both are real Cosentyx patients who will share their personal experiences this evening and who have been compensated for their time. We'll also meet Dr. Alvaro Moreira from the Novartis Medical Team, Director, Peer Education Dermatology. And then we are joined by Rachel Adams, who's a personal support specialist with the Cosentyx Connect team. At this time, I'd like to introduce you to our speaker, Dr. Alvaro Moreira, who is a board-certified dermatologist specializing in immunodermatology and oncodermatology. He obtained his medical degree from the University of Porto Medical School in Portugal and his postgraduate research doctorate from the University of Erlangen-Nuremberg Medical School in Germany. Dr. Moreira is part of the Novartis Digital Health Solutions team, focusing on next-generation healthcare provider, or HCP, education. Tonight, we're going to cover a range of topics that I think you'll find informative and helpful. First, we'll hear Jordan's story and what her treatment journey was like, as well as her experience with Cosentyx. Then we'll hear from Dr. Alvaro Moreira to learn more about Cosentyx as a treatment. This will be followed by Darren's story, treatment journey, and experience with Cosentyx. Then last, but certainly not least, we'll hear about the Cosentyx Connect Patient Support Program. There will be some time at the end for a quick Q&A. So let's get started. First, we'll hear from Jordan. Jordan, we're glad to have you here tonight. I know your psoriasis and psoriatic arthritis can be hard to deal with. We'd love to hear your story and how both conditions have impacted your life.
Hi, I'm Jordan. I am out of Seattle. I started having symptoms of psoriasis when I was a teenager, so I was pretty young, and it started just on my skin from what we could tell, kind of on my elbows, and started spreading up my arms, into my underarms, and all around. I ended up getting it all down my legs, on my face, on my ears, around my scalp, on my eyelids. So it really kind of was presenting all over in areas where you could see it. I had it really bad on my hands, on my knuckles and wrists. And when I was a high schooler, I was a dancer and a performer. So I was on stage a lot. And that's kind of in your younger years when you're kind of developing your sense of self and who you are and your self-esteem. And so it really kind of took a toll on me personally and how I developed. And the older I got, the more I started getting joint pain as well. And for a very long time, they couldn't really connect the joint pain to the psoriasis. So it actually took years to figure out that the joint pain was psoriatic arthritis. So that didn't actually get diagnosed until my early 20s. I did all the different creams and the light booths and the steroids and all the different medications for years and years, over 10 years, 15 years, different things not working for me. And it was quite a struggle to where I got to the point where I just figured, well, this is just how it's going to be. I'm just going to have to live with this. I'm going to have my morning routine of stretching it out and trying to get my body working. And some days it's just not going to happen. And I'm just going to look like this. And my career kind of developed in the food and beverage industry. I am a whiskey specialist and I was a sommelier before that. And so having psoriasis flakes on your hands and feeling like you're kind of leaving a little Hansel and Gretel trail behind you everywhere you go when you're trying to serve people wine is not very appetizing. And so it took another toll on my self-esteem in my professional career later in life. When I got a little older, I was in my late 20s. I found a doctor who was my neighbor who saw my hands one day, and he said, "You should really come see me for that. I specialize in psoriasis." And I thought, oh, well, I've been down this road before. I've seen multiple dermatologists, rheumatologists, et cetera, and I've tried all the things and nothing's worked. But I thought, what the heck? And so I went to him and he said, well, there's this drug called Cosentyx that I think you should try. And we gave it a try and went through the whole process of getting it approved. At the beginning was a little skeptical. I thought this will probably just be like everything else. It'll work a little bit and I'll get a little bit of relief, but it's not really going to do much, I'm sure. And I was shocked it was going away. I could see the plaques falling off, and then within months I was just astonished at what I was seeing. And I got to the point where my whole life changed. I was able to gain confidence that I didn't have before. I was able to wear clothes I couldn't wear before. And over the years, I actually look back at, I just hit my, oh gosh, I believe 4 years in November of being on Cosentyx. And so it's just this time of year when I went on it. And I was kind of looking back at it and I thought, man, my life has just changed so much. My personality has changed. I've gained so much confidence. And it's just crazy to look back at this journey.
Thank you, Jordan, for sharing your story with us. That's such an amazing story.
Of course.
And now I'd like to turn it over to Dr. Alvaro from the Novartis medical team, who will talk about Cosentyx as a treatment option for plaque psoriasis and psoriatic arthritis.
Thank you so much for the introduction, Bev, and thank you, Jordan, for telling us your incredible story. First, I want to explain how a biologic like Cosentyx works in treating moderate to severe plaque psoriasis and active psoriatic arthritis. Cosentyx, also known as Secukinumab, works within your body to target IL-17A. IL-17A is one of the multiple molecules believed to play a role in inflammation in people with plaque psoriasis and psoriatic arthritis. Although some IL-17A is normal, when there is an overproduction, your body becomes overwhelmed, and that leads to increased inflammation, causing you to see and feel symptoms like painful, itchy plaques that appear on the skin. In some people, that inflammation can also cause pain and swelling of the joints, as many of you know, and even long-term joint damage, especially if not treated. Now, to understand the effects of Cosentyx, we look at the clinical trial results. The clinical benefits of Cosentyx have been studied for more than 12 years across multiple indications. In this case, the clinical trials included patients with moderate to severe plaque psoriasis. The majority of people taking Cosentyx were clear or almost clear after just 12 weeks of treatment. Approximately 8 out of 10 people saw 70% skin clearance after 12 weeks, and 6 out of 10 saw 90% skin clearance at 12 weeks. Many patients who saw results at 1 year maintained them after 5 years. In this trial, patients and doctors were told which medication was being used after 3 years, because knowing the study drug used beforehand may affect the results. During one of those trials, 39% of patients who kept a psoriasis symptom diary reported an improvement in pain, itching, and scaling. One way to see how Cosentyx works is to look at before and after pictures. More than half of patients taking Cosentyx were clear or almost clear on their scalps as early as 12 weeks, compared to only 6% taking a placebo. And nail psoriasis improved by more than 46% in people taking Cosentyx at week 16, compared to 12% in people receiving a placebo. The palms of the hands and the bottoms of the feet can also be real problem areas for patients with plaque psoriasis. Here you see how Cosentyx helps treat those problem areas after just 16 weeks. In fact, more than 30% of people taking Cosentyx were clear or almost clear on their palms and on their soles at 16 weeks, compared to just 1.5% with placebo. Some patients with plaque psoriasis may feel pain and swelling that go deeper, just like Jordan. That's because some of that inflammation that causes skin plaques also contributes to pain and swelling in certain joints. This may be a form of arthritis known as psoriatic arthritis. About 85% of people with psoriatic arthritis actually experience plaque psoriasis symptoms first. About 31% of those patients with moderate psoriasis and 46% of patients with severe psoriasis end up developing psoriatic arthritis. So knowing that the two are connected can be really helpful in finding the right treatment. When we talk about active psoriatic arthritis, we are really talking about multiple symptoms. Cosentyx treats more than just joint pain. It treats joint tenderness and swelling. It also treats enthesitis, which is the medical term for pain in areas where tendons and ligaments attach to the bone. Cosentyx also treats dactylitis, which is the swelling of an entire finger or toe. Up to 60% of patients in a clinical trial saw at least a 20% improvement in symptoms at 16 weeks, versus only 18% of patients taking a placebo. For people taking Cosentyx, 300 milligrams, the results showed clear skin. 54% of people with psoriasis skin plaques saw clearer skin after just 16 weeks. The results also showed less tenderness. 56% of patients saw a complete reduction in enthesitis, that is the swelling where the tendons and ligaments attach to the joints. Patients also had less joint pain and swelling. 63% got relief from joint symptoms, including pain and swelling, and saw improved ability to function. And finally, 66% of them saw a complete reduction in dactylitis, or swelling of an entire finger or toe. Cosentyx helps stop further joint damage based on data from X-rays of the hands and feet at 6 months. When it comes to any treatment, a really common question that we hear all the time is, when can I expect to feel the results? For this, we look at the data. In clinical trials, we found that up to 60% of patients saw at least a 20% improvement after just 16 weeks, compared to only 18% of patients taking a placebo. And for patients who continued on Cosentyx for 5 years, a similar percentage saw an improvement in their symptoms. For some patients, relief came as early as just 3 weeks after starting Cosentyx. I'm sure that you have many questions right now that you'd like answered. Let's take a few minutes to go over some of the most commonly asked ones. Before we do, please remember that your doctor or healthcare provider is the best source of information. Now, you may be wondering what you need to know before start taking Cosentyx. The simple answer is that you'll need to know if you are allergic to Secukinumab, which is the main ingredient in Cosentyx, or allergic to any of the other ingredients. Another question that comes up quite often is whether Cosentyx requires any pre-screening. You should be aware that Cosentyx affects your immune system, and that may in fact lower your body's ability to fight infections. So your doctor or healthcare provider should check you for tuberculosis before start treatment. And your doctor or healthcare provider should actually watch you closely for signs and symptoms of tuberculosis during treatment. Finally, many people ask what they should tell their doctor or healthcare provider before starting Cosentyx. It is important that you tell your doctor or healthcare provider if you are being treated for an infection, or if you have an infection that keeps coming back or doesn't go away. And you'll need to tell him or her if you have tuberculosis or have been in close contact with someone with tuberculosis. Even if you only think you have an infection or if you have symptoms of an infection, it is very important to let your doctor or healthcare provider know before starting on Cosentyx. Symptoms of an infection include fever, sweats, muscle aches, cough, shortness of breath, weight loss, diarrhea, discomfort when you urinate. These and other symptoms are also listed in the full prescribing information available on our website. For moderate to severe plaque psoriasis and active psoriatic arthritis, the dosing is slightly different. For plaque psoriasis, the recommended dose is 300 milligrams. To start, your doctor will prescribe 5 weekly loading doses, and after that, you only need to take Cosentyx once a month, which means fewer interruptions in your daily routine. For some patients, a dose of 150 milligrams may be acceptable. For psoriatic arthritis, on the other hand, the recommended dose is 150 milligrams, with or without 5 weekly loading doses, and then monthly thereafter. However, if you continue to have psoriatic arthritis symptoms, your doctor may prescribe 300 milligrams every 4 weeks. And if you have both moderate to severe plaque psoriasis and psoriatic arthritis, your doctor will prescribe 300 milligrams. Cosentyx comes in the sensor-ready pen, which is designed to be easy to use and easy to hold. But even with a sensor-ready pen, we recognize that injecting yourself is always a challenge. That's why we offer supplemental resources through Cosentyx Connect to help prepare you for your first injection. These resources include access to a live, virtual injection demonstration and many supplemental videos, which are available 24/7 at Cosentyx.com.
Thank you, Dr. Alvaro. At this time, we're going to turn it over to Darren, who's another real Cosentyx patient, who will tell us how plaque psoriasis and psoriatic arthritis symptoms affected his life and how things have changed since he started taking Cosentyx. Darren, thank you for joining us. So, welcome, Darren.
All right. Thank you, everybody. Hi, I'm Darren. I'm from Michigan, and I work in sales at a credit card processing company. And I am married with 2 small children. One is 3.5 years old, and one is only 1.5. So it's quite the bundle to deal with, especially during these odd times that we're living in. I was actually diagnosed with psoriasis not too long ago. It was in 2009. I was turning 29, 30 years old at the time. I was single, working full time, all that fun stuff. And it just came out of nowhere. I didn't even know what it was. A spot appeared on the back of my arm, and I was kind of like, what the heck is this? And it started to spread. I thought it could be just dry skin or maybe eczema or something like that. So I decided to start doing some research and thought, hey, it could be something else. And I've never really been to a dermatologist. So at that time, I made an appointment with the dermatologist, and I went in there and he took a little sample, like a biopsy. And the next day called me and said, yep, it's 100% psoriasis. You want to come back in and we'll talk about it. So I went back in the next day, and he basically told me that be prepared because it's only going to get worse from here, which was obviously not the thing that you want to hear, but he turned out to be right. It did start to spread pretty aggressively all over my body. So it started to spread up my arm, then down my leg and on my scalp, you name it. There was plenty of psoriasis plaques after that point that came out of nowhere. And so we went through, like Jordan was saying, we went through the typical treatments, the lotions and the light box and the laser and things like that. And those were working somewhat for spot treatments and things like that. But it just was difficult. It took 30, 40 minutes to get ready in the morning. And I would head to work and get to work, and I work in an office environment, and I type all day. I'm busy at my desk and flakes everywhere. So I had to tell everyone what psoriasis was, and hey, I've been diagnosed with it. So that's what all these flakes are all over the floor. It was super embarrassing. So as time went on, tried more different things. I started some biologics and things like that, and they worked for a little bit, then they stopped working. And then if you fast forward that time from 2009, 2010 to around 2015, I started to get joint pain, and I didn't know what that was all about. So when I was at my dermatologist appointment, I talked about my joints, and he said that could be psoriatic arthritis. He had never really talked about it before, so it was new to me. And he recommended that I make an appointment with a rheumatologist. That was pretty difficult to get into a rheumatologist. It did take about 6 months out, is what they were telling me when I started making the calls trying to find one, but I eventually found one that had an appointment about a month out. But by that time, I had started to get what I know now as a little bit of joint damage. So if anyone's experiencing that, I would definitely recommend getting into a rheumatologist as soon as you can, because you want to try to avoid that. So I made my appointment with the rheumatologist, got in there, and he said, hey, there's a new drug on the horizon that's been approved for psoriatic arthritis. In addition, it'll help with your psoriasis, and it's called Cosentyx. And I said, all right, I think I've read a little bit about that, because I try to keep up with everything through Google and just reading about it, trying to figure out what's going on. So we got approved for that, and I went on it. And within 30, 45 days or so, I was completely clear of psoriasis, and the joint pain had started to improve around that time. It got a lot better about 90 days in. And ever since that time, I've been on Cosentyx, and I've completely changed around my entire life. I mean, when I had the joint pain and covered in psoriasis, just a complete embarrassment to see yourself like that, and to try to have to explain it to people and tell them that, hey, I have psoriatic arthritis. Well, how can you have arthritis when you're only, now I'm 40 years old, but 30s? And to try to explain what it is, and to have all that kind of rescind and go away, I can get back to everything that I wanted to do in life. Now that I have these kids, I couldn't even imagine if I had the joint pain before, picking them up and playing with them and having a good time and all that fun stuff. It's completely rearranged what I was thinking was going to happen, that it would only get worse because I was on these other biologics. They work, they don't work, they stop working. So you never really have that vision that, hey, I'm going to finally find something that works. And then we found Cosentyx, and it works, and I'm still working today, 5 years later. So really enjoying life, and I just couldn't imagine not being how I am right now. It's been a blessing.
Thanks, Darren. You had such an interesting journey, how you found out about psoriatic arthritis. So thank you.
Sure. Thanks for having me.
And finally, Rachel, a Novartis personal support specialist, is going to give us an overview of services offered through the Cosentyx Connect personal support program.
Hey, everybody. So when we talk about Cosentyx, the patient is really at the center of everything we do here, which is a great segue to talk to you about the Cosentyx Connect personal support program tools and resources. I'm a Cosentyx personal support specialist, and for everyone starting Cosentyx, someone like me will be available to support you. Cosentyx Connect is a free, customized support program for people considering Cosentyx and for those just getting started. As soon as you are prescribed Cosentyx, you're offered the opportunity to join Cosentyx Connect. Once you have registered, you'll have access to a personal support specialist like myself, someone who can help you understand what your insurance covers and answer your questions, including help getting your medication and supplemental injection training tips. So if you're considering Cosentyx as your treatment, Cosentyx Connect has resources to help keep you updated on all of your coverage options. Join Cosentyx Connect for the savings options you need to know about. For instance, if you have commercial insurance, you may be able to take advantage of our $0 copay program. And if you're still not sure about Cosentyx, you can sign up to learn more. So find out if you're eligible and get the support you need to start your treatment today. Your personal support specialist is there to help. If your coverage is denied, you can also find out if you're eligible for the Covered Until You're Covered free medication program. So to learn more about that, visit cosentyx.com/treatment-cost. And we know trying different treatment options is a big decision. So if you're considering Cosentyx, we can help you learn more. And if you've been prescribed Cosentyx as your treatment, we want to help you get your medication delivered to you as quickly as possible from a specialty pharmacy. Our team works with you and your healthcare provider to determine where you are in your approval process. Your doctor may need to fill out a prior authorization and additional forms based on your insurance before your first dose can be delivered. So be prepared to receive a call from your doctor's office or from an unfamiliar phone number, which may be calling to help this process go as smoothly as possible. And finally, getting Cosentyx delivered. Cosentyx is sent to you from a specialty pharmacy since it's a specialty drug, which simply means it requires special handling and must be refrigerated. So once you're approved, you'll receive a call from your specialty pharmacy. Again, it may be from a 1-800 number or an unfamiliar number, and they're calling to discuss the delivery details and schedule the delivery. So then Cosentyx will be delivered to you. Make sure you add the number to your phone so that you recognize the call in the future.
Thank you, Rachel. And Dr. Alvaro, do you have any comments you'd like to add?
Yes, thank you, Rachel. It's great to learn about Cosentyx Connect, and what an incredible story Darren just told us a couple of minutes ago. Before you leave today, there are a few important facts about Cosentyx that you need to know, including how quickly it might start working. In clinical trials, the majority of people taking Cosentyx were clear or almost clear after just 12 weeks. Approximately 8 out of 10 patients saw 75% skin clearance at 12 weeks, and 6 out of 10 saw 90% skin clearance after 12 weeks. Many who saw results at 1 year maintained them after 5 years, just like Darren. In the clinical trials, patients and doctors were told which medication was being used after 3 years, because knowing the study drug beforehand may affect the results. Thank you so much for joining us. Again, a big thank you to our real patients, Jordan and Darren, for sharing their stories with all of you. I hope, along with Rachel, Jordan, and Darren, that we have provided you with a better understanding about how Cosentyx works to treat moderate to severe plaque psoriasis and active psoriatic arthritis. If you want to learn more, please speak with your doctor or healthcare provider about Cosentyx to see if this is the right treatment for you. And if you need help preparing your questions, please visit cosentyx.com and use the Doctor Conversation Starter. It's an easy tool to use, just a few simple questions.
And once again, I'd like to thank all of our speakers. And now, Dr. Alvaro and Rachel, we have a few questions for you that have been submitted. So the first question is for Rachel. Are there saving options available for Cosentyx? And how can I lower my out-of-pocket costs for Cosentyx?
Yeah, thank you. That's a great question. So the Cosentyx Connect program offers savings options. So we have our $0 copay program, and that is for patients who are commercially insured and eligible, of course. If you have commercial or private insurance and you run into insurance issues, you may be eligible for the Covered Until You're Covered program while your coverage is being pursued. So it can help you receive your medication while your coverage details are being worked out. And of course, for more details about either of those options, including the terms and conditions, go to cosentyx.com or register for Cosentyx Connect.
And Dr. Alvaro, who should not use Cosentyx?
That is a very important question. And as with any other medication, there are patients who should not take Cosentyx. For example, anyone who has had a severe allergic reaction to Secukinumab, which is the main ingredient in Cosentyx, or an allergic reaction to any of the other ingredients in Cosentyx should not take it. Also, before starting Cosentyx, please tell your healthcare provider if you are being treated for an infection, or if you have an infection that doesn't go away or keeps coming back. Also, please let your healthcare provider know if you have tuberculosis or have been in close contact with someone with tuberculosis. So please tell your doctor and healthcare provider if you have inflammatory bowel disease, if you are allergic to latex, and if you have recently received a vaccine or are scheduled to receive one. Finally, please tell your healthcare provider if you are pregnant or plan to become pregnant. It is not known if Cosentyx can harm your unborn baby. You and your healthcare provider should decide together if you will use Cosentyx. And finally, please check with your doctor or healthcare provider if you are breastfeeding or plan to breastfeed, because it's not known if Cosentyx passes into your breast milk.
Dr. Alvaro, we have a question that is of concern to a lot of our attendees. Should I take a break or stop taking Cosentyx during the COVID-19 pandemic?
That's a very relevant question. It is important that you do not make any changes or stop your treatment without first talking to your healthcare provider. We believe that treatment decisions should be made together with your doctor or healthcare provider. Every person's medical condition and history are different, and only your healthcare provider can decide what's right for you in light of COVID-19. We encourage you to follow the CDC recommendations for staying safe during the COVID-19 pandemic.
On behalf of the National Psoriasis Foundation, our speakers, Jordan, Darren, Dr. Alvaro Moreira, Rachel, and Novartis. Thank you for attending Cosentyx, Secukinumab, Real Talk, a live webinar featuring Darren and Jordan. Have a wonderful evening.